Question, do your knees ache? Have you had an injury or two over the years and then dealt with that chronic pain? Our Mark Schumacher has, and when he decided on surgery to ease the discomfort, our cameras went along. It's a chance for you to see what the surgical option is all about.
So you're starting to get some reactive changes from the bone.
My problems were easy to see on x-rays and an MRI. After a few major sports injuries and then years of being a weekend warrior, the key stabilizing force in my right knee, the anterior cruciate ligament, was completely torn. In my early 40s, I'm considered too young for a knee replacement, but I desperately wanted to get rid of the chronic pain and instability.
This is ACL. This is grossly deficient.
Dr. Desimone, an orthopedic surgeon, fixed the problem by taking a section of my patella tendon, which runs down the front of my kneecap, then snaking it through the joint, screwing it into place to replace the ACL. This grafting is becoming a common fix for us weekend warriors. Here's the old ACL, and here's the new. If you happen to be thinking about surgery as an alternative, you need to know that the procedure is just the start.
Okay, let's go. All right, let's see here. How many minutes are we doing today?
While the reconstructive surgery will ease my chronic pain and make my knee more stable, you cannot get there with the graft alone.
For me, the toughest thing has been pacing myself.
Suzanne Wombold is my physical therapist at the Cora Rehabilitation Clinic in Lauderhill.
With you, you have kind of a go-getter attitude, so you're one that we have to slow down a little bit.
As much as I want to rush ahead and work the leg, the graft that Dr. Desimone put in place has to get used to its surroundings.
When you put the graft into the knee, the first 6 weeks, your body actually rejects the graft.
You heard right. Even though it's my own tissue, my body is eating away at that new ligament.
Even though you feel great at the first 6 to 8 weeks, your graft is actually the weakest at that point.
So while we wait for the graft to strengthen, I am allowed to cycle, but at minimal tension and only for a few minutes. Stretching the leg is critical as we work on its flexibility and extension.
Okay. Now what?
Okay, we're going to have you doing backwards walking.
Okay.
It sounds easier than it is.
There's no way that I don't think I could do this without looking at my feet.
No.
What does this do that going forward doesn't do?
It works different muscle groups. It works more into your glutes.
If you have chronic joint pain like I did, I discovered a few things that you should know. Years of favoring the bad leg left me with a slight limp. I am literally now having to learn to walk properly. And whether or not you go for surgery, that's certainly your decision, but study after study has shown that if left unchecked, ligament damage can lead to further degeneration of the joint and more pain.
I think a lot of physicians, a lot of orthopedic surgeons, especially sports docs, are now creating time to look at these injuries and to take care of them as soon as possible.
As my road to recovery continues, if you have any questions, you can contact me at click10.com. I'm Mark Schumacher, Channel 10 Eyewitness News on the Night Beat.
If you have knee pain, it gives you something to think about.